Thank you for joining us. My name is Peggy Francis. I'm a nurse practitioner with Urology San Antonio. Urology San Antonio is the largest urology group in South Texas. Today we're going to talk about your bladder, and most specifically incontinence. Incontinence is the involuntary loss of urine, so any urine that leaves your body when you were not expecting it. Incontinence is a very common problem. 17 million Americans have incontinence. 80% of those tend to be women, and about 20% tend to be men. It does tend to increase as we age, but it does affect all ages. So let's start with the different kinds of incontinence. And today we're specifically talking about loss of urine. We're not talking about fecal incontinence, which is also another problem, but we're talking about only the loss of urine from your bladder. Your bladder is a muscle in a very relaxed stage while you're filling. And when you sit down in the bathroom to urinate, your brain says to your bladder, this is the place, and causes it to contract. The urethra is the tube from the bladder to the outside. It is the opposite. It's contracted while you're filling and relaxes to urinate. So the bladder and the urethra, when they work like they should work exactly opposite of each other. One is always contracted while the other one is always relaxed. Now, there are two types of incontinence, each related to the dysfunction of one part of this. If the bladder is doing any extra contracting, that's called urge incontinence. It tends to be a larger volume of liquid because it's a contraction. Stress incontinence is when that urethra is not able to stay closed. It tends to be little spurts of urine, tends not to be a very large amount. Stress incontinence is when you cough, laugh, sneeze, lift, bend, jump, any sort of movement, and the urethra opens. Urge incontinence is when the bladder does extra contracting. Now, the third element that's important to talk about is the pelvic floor. This is your pelvis. Your pelvic floor muscles are this group of muscles that holds everything in. So I call this your pelvic hammock. When you urinate, pass gas, have a bowel movement, for men when you ejaculate, for women sometimes to enhance intercourse, the pelvic floor muscles should get out of the way so you can do those things unhindered. Now, you want that pelvic floor strong enough to be able to come to your rescue when you want to keep from passing gas, stop from urinating, for women sometimes to enhance intercourse. So you want that pelvic floor under your control. At Urology San Antonio, I run the Continence Center, and at the Continence Center, we do pelvic floor therapy. So we do therapy on this group of muscles. We do therapy with a probe that we place in women in the vagina, in men in the rectum. These two little metal bands on the probes allow us to deliver a little electricity to the pelvic floor muscle. What that does, electricity will passively exercise muscle, doing two really important things for us. First and foremost, I think, is it increases your perception of where your muscle is, so that when you're doing your own exercises, you'll be able to do a better job of them. You'll be able to find that muscle and contract it better. Secondly, when we use pelvic floor therapy, we are able to work your muscle out a little harder and faster than you can work it out on your own. But on your own, there are some things you can do to make your muscle stronger. When you do a pelvic floor contraction, and for women we remember those as Kegel exercises, the key is to isolate that muscle, and that is the only muscle group that you want to contract. The way we do that is if you will concentrate on trying not to pass gas. So imagine you're in a room full of people, it's really quiet, and you want to keep from passing gas. Squeeze your rectum to keep from passing gas. That's the correct muscle. That's the pelvic floor muscles. Don't use your abdomen. Don't use your buttocks. Just isolate that muscle. Imagine that you're trying just to keep from passing gas. What I suggest is that you contract that muscle for 3 to 5 seconds and relax for 10. Contract for 3 to 5 seconds and relax for 10. 10 times in a row sitting, 10 times in a row standing, 10 times in a row lying down every day. The key to getting better with pelvic floor exercises is consistency. You need to do them every day. I suggest you do each set with something else that you do every day in that position. For example, I couldn't go to bed at night if I didn't brush my teeth, and I always stand to brush my teeth at night. So it makes sense to me to do my standing pelvic floor therapy when I stand to brush my teeth at night. So that's when I do my standing exercises. So whatever you can do to remember to do each set, sitting, standing, and lying down, Do them every day, and you'll find that muscle will get stronger. So the goal is to get that muscle strong enough to keep the urethra closed when you need it to stay closed. If you are troubled by leakage when you cough, laugh, sneeze, lift, bend, jump, some sort of movement, if you can remember to try to contract that muscle before you stand, before you move, before you sneeze or cough, sometimes that will keep you from leaking, or you will leak a little bit less. As far as urge incontinence is concerned, that's the incontinence when your bladder does some extra contracting. What I'd suggest you try to do with that is, if you will try to contract and release your muscle 5 times, just real quick, sometimes that will tell your bladder just to give you a minute to get up to get to the bathroom. That's called urge suppression. Now, if we're going to talk about the various treatments for stress and urge incontinence, stress and incontinence has surgical procedures but no medications. For stress incontinence, there is a tape. It's called a transobturator tape, a thin little piece of mesh that looks like the same sort of mesh that they fix hernias with. The doctor will slide that in and lift the urethra with that. We've been doing that for women for years, but now there is a procedure actually for men to do the same procedure. So all it is a little support for the urethra to help you keep from leaking when you do movements. There are surgical procedures for stress incontinence and no medications. There are medications for urge incontinence and no surgeries. You'll recognize urge incontinence as you've seen in the commercials, gotta go, gotta go, gotta go. That's urge incontinence. We have multiple medications for urge incontinence. You might recognize a few of the names: Ditropan, Ditropan XL, Detrol, oxybutynin, Sanctura, Vesicare, Enablex, all very good medications. There's not one medication that I choose to put every patient on. Patients are different. They respond to medications differently. So I have just as many patients on each of those medicines that like it as I have put on those medications that didn't like it. So the key is to just talk to your healthcare provider about what your problems are, whether there is a medication to help you, and what kind of problems you're having with the medication. Number one side effects with any of the bladder medications are constipation, dry mouth, dry eyes, and for some patients they get dizzy with those medications. I call bladder medicines tranquilizers for your bladder. They are not really tranquilizers, but for your bladder, all they do is calm your bladder so it doesn't do any extra contracting. It's important to recognize that incontinence is a nuisance. It's a real problem, but not being able to urinate is a worse problem. So though you don't like leaking, if you were not able to urinate at all, that's not a good problem, because your urine has to come out and it might go backwards towards your kidneys, and that's very dangerous. So incontinence is a nuisance, but it's a problem that we can deal with. It's not a problem that you have to suffer with. There are treatment options, so it's important you discuss those with your healthcare provider. Taking care of your skin if you have incontinence issues is very important. It's important that you stay dry. So when your pads become soaked, it's important that you change your pads, put a drier pad on, and if you have any skin breakdown, to treat that skin breakdown. The creams and ointments that are used for things like diaper rash are the same kinds of ointments that you can use on your skin to help keep it healthy, but it's very important that you stay clean and dry. Now, when I suggest that you stay clean and dry, I also want to emphasize that it's important not to use cleansers on your bottom. No soap, body washes, feminine washes, wipes, sprays. Those things contribute to the irritation on your skin. They don't tend to make things better. So limit your use of any kind of cleansers on your bottom. Keep it very dry. That may mean that you take a hairdryer now and then and dry. As far as incontinence supplies are concerned, there are many good products on the market. I'm not going to begin to discuss the kinds of products. Our local pharmacies and our local grocery stores carry a lot of good products, but there are also incontinence supply companies that will mail you your products. And my understanding is that the prices of these are just comparable to what you're going to get at the local pharmacy. So don't hesitate to ask your physician if they know of a supply company that can provide some of your supplies. They'll help you deal with insurance issues. Not all insurance companies will cover any incontinence supplies. Some insurance companies cover them quite well, but these incontinence supply places will help you deal with your insurance company to see if they can help you pay for some of your products. I want to thank you for coming today and talking about incontinence. If you have any other questions, again, my name is Peggy Francis. I'm the nurse practitioner with Urology San Antonio, and we'd be happy